Syphilis is a serious infection. It is spread through sexual contact. It can cause long-term health problems if not treated. Many people with syphilis don't have any symptoms. They may not know they are infected. This makes it important to get tested if you are at risk. Syphilis is treatable with antibiotics. Early treatment is essential to prevent serious complications. Let's learn more about syphilis and how to protect yourself. Syphilis is caused by a bacterium called Treponema pallidum. This tiny organism thrives in warm, moist environments. It spreads through direct contact with a syphilis sore. These sores are called chancres. They typically appear on the genitals, rectum, or mouth. However, they can also develop in hidden areas. This makes it easy to spread the infection unknowingly. Syphilis can also be transmitted from a pregnant woman to her unborn baby. This is called congenital syphilis. It can have serious consequences for the baby. Knowing how syphilis spreads is the first step in protecting yourself. Syphilis progresses through distinct stages, each with its own unique set of symptoms and potential complications. Understanding these stages is crucial for early detection and effective treatment. The first stage is known as primary syphilis. During this stage, a painless sore or chancre appears at the site of infection. This sore is highly infectious and can appear on the genitals, anus, or mouth. Primary syphilis, a painless sore or chancre appears at the site of infection. This sore usually heals on its own within 3 to 6 weeks, but the infection remains in the body and can progress to the next stage if not treated. Even though the sore heals, the bacteria are still present in the body. If left untreated, syphilis moves into the secondary stage, secondary syphilis. This stage is characterized by a skin rash that often appears on the palms of the hands and the soles of the feet. Other symptoms may include fever, sore throat, and swollen lymph nodes. These symptoms can be quite varied and may come and go over a period of weeks to months. These symptoms can be mild and easily mistaken for other conditions, which is why syphilis is often called the great imitator. It's important to seek medical advice if you notice any unusual symptoms. Latent syphilis. If secondary syphilis is not treated, the infection can enter a latent stage. During this stage, the bacteria remain in the body but may not cause any symptoms. This stage can last for years, and without treatment the infection can progress to the most severe stage. This stage can last for years, sometimes even decades. During this time, the infection is still present and can cause serious damage to the body if not treated. Tertiary syphilis. This is the most severe stage of the disease. It can occur years or even decades after the initial infection. Serious complications can arise, affecting the heart, brain, and other organs. These complications can be life-threatening and may include neurological problems, cardiovascular issues, and damage to other organs. This stage can be life-threatening. It's crucial to seek medical treatment as soon as possible to prevent these severe complications. It's important to remember that syphilis can be present even without symptoms. Regular testing is crucial, especially if you are at risk. Early detection and treatment can prevent the disease from progressing to these severe stages. Always consult with a healthcare professional if you have any concerns or notice any symptoms. Muscle pain is a less common symptom of syphilis. It can occur in the later stages of the infection. This pain can be widespread or localized to specific muscle groups. The bacteria that cause syphilis can invade various organs and tissues. This includes the muscles, bones, and joints. This invasion can lead to inflammation and pain. Other complications of syphilis include cardiovascular problems, neurological disorders, and vision or hearing loss. Early detection and treatment are essential to prevent these serious health problems. Section 5. Early detection. The key to conquering syphilis. Early detection is crucial in the fight against syphilis. Testing is the only way to know for sure if you have the infection. Testing for syphilis is simple and involves a blood test. This test looks for antibodies produced by the body in response to the infection. If you are sexually active, especially with multiple partners, talk to your doctor about getting tested for syphilis. Regular testing is recommended for those at higher risk. Remember, early detection allows for prompt treatment and prevents long-term complications. Section 6. Fighting back treatment options for syphilis. The good news is that syphilis is treatable. With the right medical intervention, individuals can fully recover from this infection and lead healthy lives. The standard treatment for syphilis is penicillin. This antibiotic has been the cornerstone of syphilis treatment for decades due to its effectiveness. Penicillin works by killing the bacteria that cause syphilis, known as Treponema pallidum. This antibiotic is highly effective in eradicating the bacteria from the body. The dosage and duration of treatment depend on the stage of the infection. Early detection and treatment are crucial for a swift recovery. Early stages of syphilis can be treated with a single injection of penicillin. This simple and quick treatment can prevent the infection from progressing. However, if the infection has progressed to a later stage, multiple doses or a longer course of treatment may be necessary. This ensures that the bacteria are completely eliminated from the body. For individuals allergic to penicillin, alternative antibiotics are available. These alternatives can also effectively treat syphilis, though the treatment regimen may differ. It's vital to complete the full course of treatment as prescribed by your doctor. Stopping treatment early can result in the infection not being fully cured and can lead to complications. Following your doctor's instructions is crucial for successful treatment and preventing the infection from returning. Regular follow-up appointments may be necessary to ensure the infection has been completely eradicated. Post-treatment care is an essential part of the recovery process. Your healthcare provider will monitor your progress and may conduct additional tests to confirm that the infection is gone. Education and awareness about syphilis are also important. Understanding how the infection is transmitted and the importance of early treatment can help prevent future cases. Community health programs and seminars can provide valuable information and resources. These initiatives aim to reduce the stigma associated with syphilis and encourage individuals to seek timely medical care. Remember, syphilis is a treatable condition. With proper medical care and adherence to treatment, individuals can overcome this infection and maintain their health. Section 7. Protecting yourself and others. Prevention strategies. In this section, we will explore various strategies that can help you and your loved ones stay safe and healthy. Prevention is a key component in the fight against syphilis and other sexually transmitted infections. By adopting these strategies, you can significantly reduce your risk of contracting and spreading these infections. Prevention is always better than cure. This age-old adage holds especially true when it comes to sexually transmitted infections. By taking proactive steps, you can protect not only yourself, but also your partners and the wider community. Here are some ways to protect yourself and others from syphilis. Practice safe sex. Safe sex practices are essential in reducing the risk of transmission. This includes using barrier methods such as condoms and dental dams. Use condoms consistently and correctly every time you have sexual contact. It's important to ensure that the condom is used from the beginning to the end of the sexual activity to provide maximum protection. Limit your number of sexual partners. By having fewer sexual partners, you reduce the number of potential exposures to syphilis and other STIs. This is a simple yet effective way to lower your risk. Having fewer partners reduces your risk of exposure. Get tested regularly. Regular testing is a crucial part of maintaining sexual health. It allows for early detection and treatment, which can prevent the spread of infections. Regular testing is crucial, especially if you are sexually active. Many STIs, including syphilis, can be asymptomatic in their early stages, making regular testing even more important. Talk to your partner or partners about STIs. Open and honest communication about sexual health can help you and your partners make informed decisions and take appropriate precautions. Open communication about sexual health is important. It fosters trust and ensures that everyone involved is aware of the risks and the steps needed to stay safe. By taking these preventive measures, we can work together to reduce the spread of syphilis. Remember, prevention is a shared responsibility. By staying informed and proactive, we can create a healthier future for everyone. Section 8. Seeking help. Don't let stigma stand in your way. There can be stigma associated with sexually transmitted infections like syphilis. This stigma can prevent people from seeking testing or treatment. It's important to remember that anyone can get syphilis. Seeking medical attention for syphilis is a sign of responsibility, not shame. Your health is paramount. Don't let fear or embarrassment stop you from getting the care you need. Section 9. The final word, syphilis, is treatable. Don't delay care. Syphilis is a serious but treatable infection. Early detection and treatment are essential to prevent long-term health problems. Remember, syphilis can be present even without symptoms. Regular testing is crucial for early detection. Penicillin is the most effective treatment for syphilis. Prevention is key. Practice safe sex and get tested regularly. Don't let stigma prevent you from seeking help. If you have any concerns about syphilis or your sexual health, talk to your doctor. They can provide guidance, testing, and treatment options.